think it's 6 weeks. I haven't smoked a cigarette, and I feel so good. I just like getting my teeth. It's a life-changing journey.
So the patient you just heard from is so overjoyed with her brand new smile. But the one thing she was concerned with before her surgery was that she was a smoker. Smoking and vaping and nicotine products do delay the healing process after the all-on-4 procedure. And smoking and vaping and nicotine products do decrease the chances of success of the implant surgery. We're going to hear from Dr. Slovan, and he's just going to talk about specifically how smoking and vaping are detrimental to the success of the all-on-4 procedure. And you can decide and make an informed decision on whether this is the right procedure for you.
Smoking is going to have several consequences that are going to be detrimental to the success of your implant placement. Well, first of all, when you smoke, you're heating up the oral tissues, you're damaging them, you're creating a dry environment, you're getting dry mouth. And even if you have teeth and if you have dry mouth, you don't have the saliva available to wash away a lot of the bacteria and sugars, so they sit around on your teeth and on your implants for a long period of time, eating away the bone, causing inflammation. Another factor smoking does is it restricts the amount of blood and oxygen that are going to be able to get to your oral tissue. So you're not going to be able to heal as well from injury, from surgery, and from implant placement.
The promises I made myself before I got the teeth was if I got them, I was going to stop smoking. Because I've tried before and it didn't work out real well. This time, before surgery, I went on the patch, stuck with it for the week before surgery and stuck it on ever since. And that is that's a big added bonus to my own health.
When you have a tooth removed, typically there's a hole, there's a socket that usually fills with a blood clot. That blood clot over time will heal and partly turn into bone, and some will turn into tissue, but it needs an oxygen-rich environment and it needs blood flow to do that. Without that, the healing process can be damaged. You could get a dry socket if you've ever had a tooth extracted and that blood clot gets popped or removed due to smoking, and you have a cavity there with bone exposed, very painful. And the same type of thing happens when you put an implant in. The implant and bone undergo something called osseointegration. That's where the bone integrates with the implant. It typically takes several months to occur, and if you smoke during that time period with the reduced amount of oxygen, with the reduced amount of blood flow, you're going to negatively affect that integration process and have a higher chance for implant failure than a non-smoker. Implant failures are 2 to 4 times higher with smokers than non-smokers, primarily due to the effects of reduced oxygen, reduced blood flow in the area around the implant.
Thanks to Dr. Slovan for providing us that great information today. If you want to see if you're a candidate for the all-on-4 procedure, you can go ahead and take our 60-second quiz and click on this link up here. And if you are not quite ready to go ahead and take the plunge for that quiz, you can go ahead and watch some more videos. And you can click down here on this link.